In today's scenario, most of the younger and mid-age generation are so busy in their work and everyday schedule that they hardly find the time to spend with their elder ones, whether it's their parents or grandparents. As a result, most of the elder people are being sent to the long-term cares by the families, or even if they are at home, they have to take care of themselves most of the time. Therefore, the chances of the falls are increasing day by day, especially at home. So me and my team members came up with a solution which might can bring a big change in the life of elderly people and therefore can help them to lead a positive and falls free life. So our project name is SmartElderCare. The persons who will be highly impacted with this great invention and the changes are the old age people, their families, the physicians and the nurses in the long-term cares. My first partner is Sergio Hernandez. He is a computer programmer student in Seneca, and his role in this project is of solution architect. Me, I am Palak, and I am a fitness and health promotion student in Seneca, and my role in this project is of elder care specialist. And the last member of our team is Navreet Kaur. She is also a fitness and health promotion student, and her role in this project is fitness and health specialist.
For the implementation of the solution, we are going to use the Continuous Patient Monitoring architecture by Microsoft. Given that IoT Azure services are compatible and already include templates to get information from Google Fit, and that nowadays wearable devices type band or smartwatch are easily accessible for everyone, we are going to make use of these existing devices to get patient physical activity and heart biometrics. So, the first step is to collect data from the sensors of the standard wearables list. The optical sensor for heart rate and blood pressure, and the accelerometer and gyroscope for physical activity, quality of sleep, and fall detection. A mobile phone is going to work as a gateway to collect the data via Bluetooth and then transmit it to an Azure IoT hub. This application will also work for the user to visualize tips depending on his daily activity, the feedback of the doctors, and the machine learning component that we will be covering in further sections. Here, for example, the application is telling me I haven't done enough physical activity recently, which is true, and it explains to me the reason why I should do some exercise, which will prevent a possible fall. The second step is to subscribe the mobile application to the list of the devices in Azure IoT Central, which has a ready-to-go template for patient monitoring. Here we can set a group of rules with the variables we are intending to assess, as we mentioned before, the quality of sleep, the quantity of physical activity, and so on. Because we want to include more information in our model, like medication the patient is taking, clinic history, and we want to learn from historical data about which of the variables we are sensing are more related to fall incidents, we will follow the architecture with the combination of the IoT Central, IoT Hub, the Internet of Medical Things FHIR connector, and a machine learning component. Finally, a Power BI dashboard component for the health provider to track the advance of the patient.
As we move further into the 21st century, we continue to develop the technologies that has equalized the relationship between medical professionals and patients and improve the quality of life. Our assessment tool to prevent the cause of falls in elder people will encourage proactive healthcare. Every patient has a specific reason for falls. The assessment device will identify the reason for it in each patient so that the doctors can treat the underlying condition to prevent the falls in elder adults in future and will manage the other adverse health conditions. It can directly impact the clinical decision making and will improve the quality of patient care while reduce the healthcare cost spent by the government every year. It's our duty to take care of our elders. Our generation should come forward to protect our elders not only in Canada but all over the world.